All health stakeholders agreed that the Global Fund has done a commendable job in availing the much-needed resources that have helped tackle malaria, HIV/AIDS and tuberculosis, 3 diseases that have had a toll on the economies of poor countries. Innocent Lyerson is a senior program manager of the African Council of AIDS Service Organizations. He says,
"We have to recognize that this financial mechanism is the one in the world really providing resources to save lives."
The experts say that the Global Fund has managed to create wonderful disbursement and tracking mechanisms that has not lent to abuse. But they also agree that this financial mechanism is also facing financial challenges.
Global Fund is facing several challenges on the replenishment issues. And our partners, mainly some billionaires in the world, mainly some company in the world, some government also in the world, committed to contributing to Global Fund, the financing system. But right now, we are still waiting to get about $20 billion, and we are not coming into it. Yeah, it's a funding gap. But the other side also is from the countries who are the recipient to manage the money in the way that it could be efficient and goes to save lives.
The world economic recessions, coupled with catastrophes like what has happened to Japan, are going to have big repercussions on this fund and its future. If you look at Japan, which is the 3rd largest contributor to the Global Fund, it looks like they are definitely not going to contribute in the next replenishment because they have their own problems with the tsunami and whatever has just happened in Japan.
Even with the challenges, a number of important issues in the response towards combating HIV remain underfunded. Professor Alois Orago is the director of the National AIDS Control Council of Kenya.
We need to revolutionize prevention. Because for every 2 people we put on treatment, every 1 person we put on treatment, 2 people are getting newly infected. And that means we should focus more on prevention and without ignoring these people who are already infected. The biggest burden is carried by women and by extension the youth.
Okay.
Because young girls aged between 15 and 24 years are 4 times more likely to be carrying the virus compared to boys of the same age group.
Professor Orago adds that the country's program will begin focusing on HIV and AIDS in women.
As a program, we are now thinking of engaging women much more in programming than before because they still carry the heaviest burden of disease for us. Involve them in program design, program implementation, review, and redesigning.
Okay.
Monitoring, implementation, monitoring, and review.
At the community level?
At the community level, mostly because 70% of the disease burden here is still at the community level.
James Kamau, coordinator of the Kenya Treatment Action Network, feels that the Global Fund has been supporting women and children over the years. There is, however, need for campaigns to eliminate pediatric HIV.
Let us eliminate pediatric HIV, and this will be a step in the direction of removing HIV from the service of the earth. So then elimination needs to be there. But you cannot eliminate, or you cannot let a child be born HIV negative and let the mother die. The mother needs to be put on treatment. So they need to double that up. So they need to look at systems where the value, the end value of whatever results or whatever interventions they're doing is much more than the monetary value that is there.
Unfortunately, many of these needs may never be met.
The Inspection General from the Global Fund, was in different countries in Africa for the monitoring and the audit process. And we realized that there is a lot of mismanagement.
We know that there's misuse. We know that there are people who are supposed to have gone to court, which has never been done. We need to have the people who in the government and the people who are doing it accountable for whatever issues that they are doing.
Additionally, Kamau says that Kenya's absorption capacity is poor as a result of bureaucracy. Kamau says that the Global Fund Round 7, which were disbursed in June 2009, have not been fully utilized, while the Global Fund Round 2, which were to tackle TB, were never used and had to be taken back.
Each round is a 5-year program, and within that 5 years we are supposed to be able to use these funds. And let's get this very right. These are not free funds. Our governments have been treating this as if it is free funds. This is money from the developed world, and we have to account for it, and we have to show that it is working.
However, Professor Orago refutes this.
I think for Kenya, I would like to tell you that we don't have that evidence yet from any partner. If anything, Kenya receives the highest paper funding out of the 15 countries because we are the only country that receives $510 million every year up to 2014 from PEPFAR to support our HIV and AIDS program. I think I can also tell you that there's a lot of donor confidence in you, in us, because we have just received the news of $345 million under Global Fund Round 10 application.
Larsson concurs with Professor Orago, saying Africa is working hard to democratize her country coordinating mechanism so that they improve efficiency in finance management.
If really this kind of mechanism at country level was working efficiently, this mismanagement issue would be maybe reduced. The impact or the effect will be severely reduced.